And for those of us that are living with chronic disease, especially neurological diseases, this is a really important topic because the parasites are causing the neurological symptoms that we're dealing with. They are causing the cognitive impairment that we're dealing with, the mood issues, the depression, the memory loss, the foggy head, the anxiety. They're also causing all the mobility issues also when we're talking about spasms and loss of balance, paralysis, numbness. And so this is a really important topic to start to learn about some of the different types of parasites that do invade our central nervous system and do give us these horrible, horrible symptoms. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 30 years ago, and by the grace of God and work on my part, I learned very early on that the symptoms I was dealing with were infections. And a lot has happened since that time. I've had an amazing, wonderful life, had another child, went to university, got a science degree. I was a teacher for many years, but I coach also. And then I left the school district and I coached full-time. And now we've coached over 700 students in the Live Disease Free Academy, helping them to recover from chronic disease. And treating these parasites in the central nervous system is the most important part of recovery. Because yes, it's important to eat healthy. Yes, it's important to live a healthy lifestyle. But many people are doing that before they were diagnosed with these horrible diseases like MS, Parkinson's, ALS, PLS, etc. So it's not just that some people are couch potatoes and they have an unhealthy lifestyle. It is that they were carrying this parasite burden in their central nervous system. And it gets to the point where the population becomes too high of these parasites, and we end up that our immune system is no longer able to deal with it. They're no longer silent infections. They become where we have so much inflammation that we do have very strong neurological symptoms. So that's what we're talking about today. I'm not going to cover all the parasites. There are so many parasites that can invade the central nervous system. We're not going to talk about fungus. We're not going to talk about Lyme disease. We're just going to stick with a few that maybe would be something that you wouldn't think about, of different types of parasites that would invade. So the title of the study that I'm reviewing, it's called, you can look it up after if you like online. You can find it very easily. It's open access. It's published in 2016. So the nice thing is with an open access article, you can actually read the whole thing. It's not just the abstract. And if you don't like science, if it's too complicated, you can just skim through it, or the beginning and the end. A lot of times we'll summarize what the article is all about. So the title of the article is called Parasitic Diseases of the Central Nervous System. And then there's a colon, Lessons from Clinicians and Policymakers. So Parasitic Diseases of the Central Nervous System, Lessons from Clinicians and Policymakers, published in 2016. And again, this is not all the parasites that can invade the central nervous system, but it is showing you some that you probably never thought were invading, like different types of worms, etc. So when we talk about a parasite, it's important that we first recognize what a parasite is. And a parasite, hello, hi you guys. A parasite is some kind of an organism that lives off of us. And so it's causing us harm. So it's living inside of us and it's causing us harm. It is not a mutually beneficial relationship. They're freeloaders. They're causing immune reactions in us. They're stealing our nutrients. They're creating a toxic environment. If we have a few parasites, we may not notice a lot of symptoms, but it's the degree of the infection and where the infection is located. Those are the two really important things. So the parasites, again, fungus, I've done other videos. You can go to our infectious playlist, infections playlist on YouTube, Live Disease Free, to watch other videos about filarial worms and Lyme disease and fungal overgrowth, things like that. But today we're going to talk about some of the parasites that were listed in the study. In the study, they separated out the parasites either as a single, I'm going to make it really simple, okay? I'm taking all the big jargon out, or most of it. So they separated the parasites that that some of the ones they listed that invade the central nervous system into single-celled or multi-celled. So a single-celled would be something like a bacteria or a protist. A protist is a single-celled parasite. And just some examples of protozoa that can infect the central nervous system. This is not all of them, but just a few. So malaria, you've probably heard of malaria before. Toxoplasmosis, that is a single-celled parasite that we can become infected with if we, let's say, one of the ways is through cat litter, if we're changing the kitty litter, because cats can carry it. Amoebas, but there's other ones also. So those would be just single-celled. The multi-celled parasites would be the worms. And that's what we're really familiar with when we think about parasites. We think about worms. So the ones that get into the central nervous system, they're not going to be the 2-foot long roundworms. They're not. And the very large tapeworms, they're not going to get into the central nervous system. But the immature form, the larvae, get into the central nervous system of those larger worms, especially the tapeworm. That's very, very common. I mean, when we're talking about parasites in the central nervous system, the tapeworm larva is quite a common thing. So there are roundworms, there are flatworms. So as far as the flatworms, those would be the tapeworm larvae that get into the central nervous system. And the adult form could live in our intestines. Sometimes they move into places like our liver. But there's also flukes, and that's something that we might not really think about. We don't talk a lot about them, but they are present and they can be small. There can be liver flukes, there can be intestinal flukes, and there are other types of flukes that can get into the central nervous system. And as far as the roundworms, those could be like filarial worms. Watch some of my videos that I talked about Dr. Alan McDonald's work where he found filarial worms in the central nervous system of people that had MS that died. So these were specimens from a brain bank, confirmed cases of like advanced multiple sclerosis, and found tons of these little filarial worms. And in animals, when those worms are present in the central nervous system of domestic animals, they have all the symptoms of MS. So that's a really important thing to start to look at. And you can watch Dr. Alan McDonald's lecture. You can just go to livediseasefree.com. Under research, under parasites, you'll find a direct link to his Vimeo lecture there. So there are filarial worms, which if you've followed my work, you know I talk about those. There's strongyloides. There is toxocariasis, which is a type of small roundworm that dogs would pass on to us, and maybe other animals too. And there's others. So those are just a few small roundworms. But then as far as the tapeworms, those would be more the larvae that would definitely, because tapeworms can get really big. When parasites get into the central nervous system, if they are small filarial worms, they can be in the worm form. But when they are in the larva form, they often form cysts, and sometimes, especially with the tapeworms, cysts and a few different species can also form these. They're kind of like a bladder or a sac where a whole bunch of the different larvae will go in, and it makes it kind of tricky to treat those. Sometimes medications work, sometimes they have to use surgery. But again, the symptoms that we get, and this is the hard thing, is that we're probably never going to find a single pill cure for MS, because in my experience with our students, that they're testing well for different parasite drugs. Not all of them are the same. So a certain parasite, if it gets into a certain location in your brain or your spinal cord, will cause certain symptoms. So maybe there are more than one type of parasite that can get into that location, wherever that is, and affect those nerves and cause the balance issues or the paralysis or the numbness or whatever the symptoms you're having. So that's how we have to think. We have to think not that, that we have one parasite and we're getting rid of it. And what would be really nice with research is not just to examine the spinal fluid for the types of parasites they can find in it, but also to really pay attention, if they are doing an MRI, to where the lesions are located. And I think they do that already, to kind of say, okay, well, if the lesions are in this part of the base of the brain, then they have these kind of symptoms. And if they're located more in the spinal cord area, lower down, then they have these specific neurological symptoms, because it's disrupting the flow, the nerve impulses wherever it's located, and that'll affect a specific part of our body. So that is the problem, is that because different parasites can get in the central nervous system and it's really where they set up camp and where they start to cause the inflammation. The inflammation is the war zone where our immune system is fighting, and that determines really the symptoms we're having, left versus right side of our body, or the various other symptoms I talked about. So one of them, toxoplasmosis, is something that many of us may not think about getting into the central nervous system, but it commonly, most common in the brain, the retina, the skeletal muscle, and cardiac muscle, so the heart muscle. And when you look at the science of these parasites in the central nervous system, you'll see very often that in the scientific literature that when parasites are in the central nervous system, they are causing lesions. So they're one of the causes of lesions. And some of the symptoms for toxoplasmosis, again, this is a single-celled parasite, protozoa, fever, and again, maybe on the onset or maybe periodically if our immune system has allowed the infection to become too populated and we end up with a fever, but it's not all the time. We can have a chronic state too. So fever, headaches, confusion, seizures are common. Vision impairment, brain swelling, also a risk of developing depression or other psychiatric disorders, also a risk of various neurological disorders, including epilepsy. So this is just giving you a really quick summary of the possibilities of these infections. So when we talk about malaria, that is the most common parasite disease worldwide. And we might think, well, it's a third world country or it's somewhere overseas, but many of us are traveling. And the thing is that a lot of the assumptions we made about parasites, they're not necessarily true. We're finding that more and more. Things are a lot more common than we're told. So the first symptoms are usually non-specific, might have headache, fatigue, abdominal discomfort, muscle aches, irregular fever, then nausea, vomiting. You can have a sudden drop in blood pressure, maybe when you stand up and everything goes, you get dizzy and you feel like you're going to pass out. You can have that. Also seizures, epilepsy, cognitive impairment, behavioral disorders. Interesting that the parasites in the brain cause behavioral disorders. We have an epidemic of behavioral disorders in our kids today, in our children. And one wonderful hero that I love, Carrie Rivera, she is really working in the autism community, helping kids to recover, helping parents to help their kids to recover. And so that is amazing. And that really helps the behavioral disorders as you're treating these infections. Gross neurological deficits are common, and there is a clear association with malaria and epilepsy, which I didn't know. I thought it was more of the different types of worms that were more linked with epilepsy. Schistosomiasis, which is the flatworm, and the fluke. So the fluke, basically, which are little flatworms. You guys can look at pictures of them after. They look like a little, they're kind of oval shaped. They're sometimes a little bit translucent color, usually not very bright, kind of like a creamy brown color. But they can infect the brain and the spinal cord. We can have fever. We can have increased eosinophils, which is a type of white blood cell that our immune system, that's the white blood cell that really goes after parasites, eosinophils. It's not always elevated, though, especially in a chronic state, especially if these flukes get into the central nervous system, then we might not find the elevated eosinophils, those white blood cells in the immune cells. We wouldn't necessarily find them in our blood. Rashes, cough, fever. Patients commonly are asymptomatic. So if the population isn't too strong in the body and our immune system is strong enough, then we may not really have significant symptoms. But it's when we're in the state of severe dysbiosis where we have multiple infections, maybe we have a lot of stress in our life, not enough sleep, maybe we're eating the wrong foods. All these things together cause these infections to become a little bit too active, causing our immune system not to be able to deal with it. And then we have these acute issues where we might have encephalopathy, which is an altered mental state, leaving us confused and we don't act like our normal, usual self. Oral disturbances, so inflammation in the mouth, muscle weakness, stiffness, spasms, and cramps. Does that sound familiar, like with MS? And then if we go to different types of tapeworms, So there's a few different species or cousins of tapeworms that can get into the central nervous system. And one group of them will cause these cysts, and another group will cause these cyst-like bladders. And I talked about that in a previous video, so we'll go into that just really briefly here. So the neurocysticercosis, these words, I hadn't practiced before, but whatever. There's cysts in the brain and the spinal cord that can cause seizures, headaches, impaired vision, and cognitive dysfunction. Can also cause generalized muscle weakness. And so that's the cyst form. So that's like a couple of different species of tapeworms. The immature larvae, they end up getting into the central nervous system. And this is really something I'd like to research, is that why is it that we have a leaky blood-brain barrier? Why is it that or are they just crossing it, and then our immune cells are causing the blood-brain barrier to be more leaky to allow the immune system to go in and to fight the battle? Is this the chicken or the egg? We don't know, or I don't know yet, but that's something that I'd really like to research. So maybe it's just that the parasites get into the central nervous system and then we end up with this inflammation, and that's part of the process. Or maybe there's something that happened to us, like, I'm not going to say the word, but, maybe some medical intervention we had that may have caused the leaky, or maybe something in the environment. It could be glyphosate, for example. It could be another chemical. Glyphosate is the active ingredient in Roundup. But there could be things that are causing the leaky blood-brain barrier. And this is true for our kids too, because we're seeing an epidemic in all of these brain disorders, neurological disorders, learning disorders, behavioral disorders. It's awful. So the other one is the synerosis, and that is what Dr. Alan McDonald found just a few months ago. He published, not formally published in a study yet, he's doing that, but he published a poster, and I've shared that in one of my previous videos, and I think that that'll be in the infection series under YouTube, Live Disease Free. And he found not only those bladders of the larva of the tapeworm, and this is different species than that first one that forms cysts. So these are different types of tapeworms that get into the central nervous system. So what Dr. Alan McDonald found were not just the immature tapeworm, but he found a juvenile developing tapeworm, and that's never been seen in science before, where they have, well, number one, I believe he's probably the first one who's really found parasites in the central nervous system. I know that other researchers have found fungus, they found Lyme disease, Borrelia, and they are considered parasites too, but I guess we would say worms. He's the first one who's found worms in the central nervous system of MS patients. He's such a hero. He should get awards for that. So he found a developing, and go back and watch that video after, where you can actually see this tapeworm, and there could be more. He looked, but he didn't have all the spinal fluid. So what these people that died that had, advanced multiple sclerosis and their spinal fluid was frozen, they were probably just small samples. I'm sure it wasn't all the spinal fluid. So just what he was able to look through, he found the tapeworm, the immature form, but also the juvenile developing tapeworm. So normally the larva of the tapeworm doesn't turn into a tapeworm in our brain, but he found a developing one that was developing. And I don't know how far it would get, but that's pretty disgusting, really disgusting. And then there is toxocariasis. Yes, that is a roundworm. So that's a very small roundworm found in dogs. And when it gets in the central nervous system, it can cause seizures, meningitis, optic neuritis, and significantly higher incidence in epilepsy. So again, it's just like with MS, like with epilepsy. So with epilepsy, they're finding different parasites that can cause these seizures. It just depends where the parasite is located as to what kind of neurological symptoms we're going to be dealing with. So just in summary, I just wanted to share a few other little things, and then I'm going to share some amazing successes with you. So parasitic infections of the central nervous system are often silent. So very often, we may have the parasites in our intestines. We may have been infected for years before. It's something that happens over time. So it's not something that we just get, let's say, bitten by a mosquito, or we end up ingesting eggs and it develops, it goes straight to the central nervous system and starts to cause neurological symptoms. This happens over time. So at first, it's a silent infection. We don't have the symptoms, the acute symptoms that we normally would see in the advanced stages. And then the classical neurological symptoms, they are appearing long after the initial invasion of the brain. So even as it gets into the brain, we don't get immediate symptoms. They're there, they're kind of quiet. And then as our immune system becomes more compromised it's not just in our brain, but we have the gut issue. That's where the base camp of the dysbiosis is. And so that really weakens our immune system also. It would be wonderful if our neurologists and our specialists would start to examine the spinal fluid a lot more for parasites. This is something that to me makes just common sense. It's like I've shared with our previous videos on how they're diagnosing MS, especially with the spinal tap, knowing they're looking for antibodies, and we know antibodies are part of our immune's response against infection. Like, why wouldn't we look for parasites? Why wouldn't we focus on that? If Dr. Alan MacDonald found all of that, I'm sure it's not that hard to find. And then the location, that's really important to remember, is the location of the parasite in the brain and in the spine or the spinal cord. That's a really important factor as to what kind of symptoms we're having. So that helps us to understand, like, why is it my right side? Well, then trace back to your brain and what part of your brain impacts your right side or your left side or your balance center or your cognitive function or like, et cetera, and numbness and paralysis. So there is a PCR test. The DNA testing, it's not good enough yet. We wish that it was, but they haven't sequenced all the parasites. There are hundreds, if not thousands, of different parasites. There are many cousins of tapeworm and many types of roundworms, and et cetera, and even the flukes, flatworms, et cetera. So that is coming. If there was more funding to sequence those faster, that would be great. If we could maybe find that there are more common species in MS or PLS or ALS, that would be wonderful. And then we wouldn't have to sequence all of the hundreds of parasites that there are. But the DNA is fairly helpful. There are limitations too. I know when I was talking to one of the labs, they said that they take a very small sample, and if the DNA isn't in that sample, then they're going to miss it. So this is the problem with testing. We're not at a good place with testing. And it does have limitations. So the DNA is present in, you'll find the DNA if the worm is dead or if it's alive. And you can also measure antibodies. So there are some antibodies that they can measure in the blood or in the spinal fluid. Again, we don't use the spinal fluid a lot. It is an invasive procedure. I know a few people on our last Facebook Live said they had it done and it wasn't that bad. I just remember I did participate in watching years and years ago somebody having a spinal tap, and that was like 40 years ago probably, and he was in a lot of agony. So I think things have come a long way from there. But again, when we're introducing a needle into our fluid, into our spinal central nervous system, put it that way, there is a risk of introducing infections. So it would be nice if we didn't have to do that, if we could just go by metabolites. So sometimes these infections will cause the byproducts, and we could maybe measure those. Maybe we could measure antibodies. But again, in the central nervous system, maybe those antibodies aren't going to show up as much in the blood. This is all part of what we want to work towards with MCID. So the Multiple Sclerosis and Infectious Disease Initiative, a group of us getting together, wanting to get clinical trials going, getting better diagnostic tools, and also treatment plans. And we are just starting. We've just started about a month ago, and we're super excited to get going on this. So the CT scans and MRIs can be helpful, for sure. They play a role in early diagnosis for the size and location of the cysts and the lesions. So remember, when you hear lesions, I believe that they're pockets of infection. The literature, you can look at lots of science where they're showing that the parasites can cause lesions. Their presence in the central nervous system shows up as a lesion or lesions. Parasitic infections of the central nervous system cause inflammation and edema, so swelling in the brain, which has a lot of implications for symptoms. And there, as I mentioned, there's a breakdown of the blood-brain barrier, and this happens in many different conditions, not just MS. The treatments would be medical or surgical. So sometimes if there is a large bladder, it looks like a little bladder, you can actually watch videos on YouTube where they're taking this cyst, the bladder. It's like, it looks like a little white sac, and they're taking it out of the brain of a sheep. I watched it. It was awful. It was awful. But it's crazy. I think there's an 88% recovery rate when they take that out of the sheep's brain. And like just a few hours after removing it, the sheep was back walking around, and it would have had symptoms similar to MS where its mobility was greatly impacted. So there's also medications, and it really depends on the type of parasite. And that's why it would be so nice if we could just say, you know, all MS patients, they have this one tapeworm larva in their central nervous system. There's nothing else. Treat that and they're all cured. And that is not the case. Comes from working with 700 people. I wish it was the case, but it's not the case. But there are some drugs that seem to be quite helpful. So albendazole, praziquantel, parental palmitoate, mebendazole. None of our students have been prescribed triclabendazole. I've never heard of that one before. Ivermectin, and what is that other one? I don't know. Doxycycline and various antibiotics. So again, it depends on what type of infections you're dealing, what type of parasites are in the central nervous system. And it also depends if these parasite drugs will cross the blood-brain barrier. Some will and some won't. And there is great value in what we do in the Live Disease-Free Academy. And that is really to do a lot of prep work before we start treating. That really makes the treatments work a lot better. So if we decrease the food through the Live Disease-Free Eating Plan, we decrease the food to those infections. I'm going to share with you some successes already of brand new students that have just started working maybe a month ago with us. And they start to have incredible symptom improvements with their neurological symptoms. Then we support the body, make sure that we're detoxing well and support our physiology and make sure we're sleeping and having daily bowel movements and clean up our environment a little bit. And then we start to look at our symptoms, and the way that our students are figuring out with their practitioner is looking at their health history, the health history of their parents, their clinical diagnosis, the symptoms they have. And then sometimes they will take these common parasite drugs and they will get energy tested. Like they'll take a sample, like one dose, and they'll get energy tested by a practitioner who can do energy testing to see, instead of trying to figure out which parasites does this person have, what treatments are showing up to be the most beneficial, balancing them, strengthening them through energy testing. And so that's been very valuable because we don't have good tests. And I don't think we're going to have good tests for a while. And as we work with M-City to together collaborate with a few groups, a few different amazing organizations, it's still going to take time because maybe we'll find filarial worms are an issue, but then we might have babesia as a problem with a lot of people, maybe tapeworm. I believe that'll be a big problem with a lot of people. So that's where we go with that. So if we're just going to wait for a single pill cure, we're never going to find one. That's the honest truth. And just popping the parasite drugs is not going to give you the quality of life because we have ignored it, because we don't have a lot of research in that area. So what the students are getting prescribed are safe doses. But that's another really important thing, is that the combinations, and that's what this article was saying too, is that very often a combination of parasite drugs will be much more effective than just using one parasite drug. For various reasons, the dose, the ability to cross the blood-brain barrier, etc. They also sometimes use steroids to help to decrease the, let's say if you kill off parasites too quickly in the central nervous system to avoid seizures, like a strong Herxheimer reaction in the central nervous system. But we haven't had any issues with our students, and they've been using 3 to 5 parasite drugs at a time. So the research that I've looked at, there's conflicting information as to whether the steroids are helpful or not. We know that steroids really shut down the immune system, so it's not ideal. But I mean, if there is risk, if the doctor feels and it's short term, then that's something that they may use. I know they're using that with COVID right now, as far as they're using that steroids successfully just to settle down the cytokine storm, the inflammation, while they're using other things like ivermectin, etc., and having great success with that. So the combination would definitely be more effective than single drugs. So in conclusion, parasite infections in the central nervous system are largely preventable, but they're largely ignored and they're largely preventable. If we did regular parasite treatments, if we treated ourselves regularly, we could avoid having them losing their way, getting into the central nervous system and dealing with these neurological diseases. And parasitic diseases of the central nervous system that were previously labeled as exotic diseases, things that you would only get if you traveled, they're starting to show up as a serious global health problem. So that's what they have said in this article also. And I know that with MCD, I know one of the gentlemen that's with us, he pulled up an article from CDC saying that parasites are a huge global problem that is completely ignored. The precise estimates of prevalence and burden of many of these diseases is that information is lacking. And the information on the pathogenesis of the central nervous system lesions, again, is limited. And there are a wide range of the clinical manifestations. So it depends on where these parasites are located in our central nervous system as to what kind of symptoms we're going to be dealing with. So I just wanted to share, before I go to a few of your questions, I wanted to share some successes because this is why we do this work. So we do our Live Disease Free Academy call on Tuesdays, and the Wellness Champions, they share some of their successes. So I just have a couple here for you that I wanted to share that are awesome. So one of our new students shared that he just started the eating plan and reducing the carbs and sweet fruits. He's been doing that for, I would say, 3 to 4 weeks, maybe 3 weeks. And he said, my gait has improved a great deal. I have not used a cane for the past week, and my stamina has increased to the point where I'm able to walk 2 kilometers without a walking aid. That is amazing. So he's just in the prep phase. He's following the eating plan. He's reduced the total carbs. The infections are not as happy. They're still there, but they're not as happy. The inflammation goes down. We start to have less symptoms. The next student, she is treating, and she was quite disabled. So our students come, some of them are more disabled and some are less disabled. And she's shared, after doing, I think, 1 or 2 treatment cycles, I can lay down on my left side, which I wasn't able to do before. I can even sleep laying on my left side. And this is amazing when people can do this, because you have a much better sleep when you can move around at night. And then another student shared that he noticed that he's more focused. So he's just getting ready to treat, and he started using the oxidizing agent for an enema and passing a little bit of worms. But he shared, the base camp of the problem is in the gut, and they've made their way into our blood, into different organs, into our central nervous system. So it's not that we just treat the central nervous system. We really treat the gut tremendously, and the central nervous system too. So he's noticed that he has more focus when reading, and he does walk a little easier and sometimes without a cane early in the day. But he gets exhausted later in the day. And that's normal. But these are the pockets of normalcy that we start to see the huge improvements. And then another student shared that her kidney pain is gone. The joints in her hands no longer have pain and they're no longer stiff. She's sleeping better. The dark raccoon circles under her eyes are diminishing. So she's also in the prep phase. Another student in the prep phase, we've had a lot of new students joining us. We just started a few weeks ago here. And this new student shared the diet is going great. I have no MS symptoms and I haven't cheated on the diet even once. So that's what I want to see as a coach. I want to see that they're implementing the eating plan properly, to the point, not to say, yes, I'm following it properly, but that they're actually having symptom improvements. And then they're supporting the body, and then they're getting ready to treat, and then they're treating. And we will go through cycles of hitting the parasites, and that's like worms and etc. And then and protists, and then hit the fungus, and then take a break. And on the break week, a lot of times the students will use herbs that are more gentle than the drugs. And the drugs are really well tolerated, often better than the herbs, because I think they're a little bit more effective at treating the bigger worms than the herbs are. So there's less Herx reactions. So I'm going to go to your questions. And before I forget to, I just wanted to share that the Live Disease Free Challenge, the eating challenge, is done. It finished at the end of February. Finished February the 28th. And so we are going to be doing a draw, and that is on March the 5th. So that is just 2 days from now. And there will be 3 winners chosen. I'm super excited. I'm going to be doing a coaching call with 3 people. And also they're going to get a $100 Amazon gift card. It was really fun. Thank you guys for all the participation and all the great ideas on just recipes and how you're eating, how you're following the Live Disease-Free Eating Plan. Awesome. Okay, so I'm going to go on to your questions. So hello, Alexander. Hi. Sharonda. I hope I said your name right. Beautiful name. Hi, Maureen. Hi, Aurora. Hi, Jerry. Lesions in my brain. My neurologist says it's related to my left leg drop foot. Yes. And the neat thing is that when I was talking about the MRIs in a previous video, that your neurologist should actually share the images with you. Like they should be able to print off the image so that you can actually see where the lesions are. And then you can just do a little bit of research on the like that part of the brain and how, what that part of the brain, what functions in the body relate to that part of the brain. And that really helps to make sense as to why we're dealing with certain neurological symptoms. And then we have, hi, Aurora and Jerry, lesion. Oh, God, got that. Hi, KJ. Great that you're here. Hi, Jerry. Parasitic diseases. Yes, that is the cause. That is why we're suffering. Oh, thank you. I think Danielle posted, or somebody posted the article in the Facebook feed. But again, if you guys want to take a look at the study after, it is called... So the title of the study that I just grabbed some notes from was Parasitic Diseases of the Central Nervous System. Parasitic Diseases of the Central Nervous System, Lessons from Clinicians and Policymakers. And it's a 2016 study. It's open access, so you can look at the whole study, which is really nice when they do that. How do we get parasites? Joanne is asking. Let's just see here. I'll have to go back because I missed a few. So how do we get parasites? Joanne, parasites are everywhere. They're in our soil. When we buy produce, they're coming in from other countries. They're on the produce. They are, when we eat in restaurants, they can be on the food that we're eating. And also the people that are preparing our food can infect us with parasites. They're everywhere. Like you can't avoid them. Holding a shopping cart, there can be fecal matter on shopping carts, they say. And maybe not so much now because they're sterilizing everything because of COVID. But parasites are everywhere. They're part of life. If you have pets, if you've been around animals, undercooked meat, but it's not just meat eaters and not just pet lovers. If you like gardening, if you're outside, parasites are everywhere and we've ignored them. We have been told that parasites are only a problem in third world countries, and nothing could be further from the truth. That is why we have such an increase in chronic disease, because we've ignored it. And depending where they're living in our body, causing specific symptoms, that is like some like to live in our joints, some like to live in our reproductive organs, some like to live in the central nervous system, some like to live in our liver, etc. And so then we get different diseases. We may have different autoimmune diseases, we may have cancer, but they're all infectious diseases. And as you treat those infections, the diseases go away. So the other question you had is, how would they treat parasites? So I talked about some of the parasite drugs, but we have found it a lot more successful to, number one, prepare first. That's very, very important to have a successful treatment, is to not feed the infections, like really reduce the food to the infections, support the body. And then when we're treating, we're using different treatments. So we're using the parasite drugs that they test well for. Then also they're using some herbs and they're using oxidizing agents. So they're kind of hitting it at different angles. And that really helps people to recover more quickly. And hi, Sherry. Yes, constipation is caused by parasites in your intestines, especially in your large intestines, but also in the small. And that's the problem, is that we also use oxidizing enemas, which help to clear out some of the parasites in the large intestines, but we have over 20 feet or at least 20 feet of small intestine that we have to treat also. So it's the parasites in the intestines that is causing the constipation. And when my students treat them well enough, they go, wow, this is the best bowel movement I'm having like since I can ever remember. I've never had normal bowel movements, and finally now I am. So that's what's causing it, is that the wrong microbes. Hello, Kate. Hi, Heidi. Hi, Joanne. Right foot, drop foot for you. So sorry to hear that. Oh, thank you so much, Heidi. You're sweet, for your kind words. Carol, what is the best treatment for various parasites that are in the central nervous system, and how do we find out which parasites? So I answered all of that. The problem is that there are so many different kinds of tapeworms, and there's so many different kinds of roundworms. Some of the roundworms are like over 2 feet long that our students are passing. And some of them are tiny, tiny little ones that get into the central nervous system, and they might be a millimeter long or less. So like the nice thing is with the parasite drugs and with the way that we do it is that very often, like, 1 or 2 drugs, they will treat roundworms. And then these other 2 drugs might be good for tapeworms. And then these other ones might be better for flukes, intestinal, etc. And so very often, the sicker we are, the more out of balance we are. And very often we test for 3 to 5 parasite drugs at a time. And that's what I help people do. I help them to build the plan. I help them to get access to the treatments, to practitioners, and to really get ready to treat, and then to build a treatment plan. And then it's just so nice that when you're using these drugs, because if you read up on them, it's like, oh my gosh, the adverse effects sound really scary. But when you're with a group of people and they've been, working with their doctors and using them, and you see all the successes, and you hear every week people talking about, their successes and how they're feeling, and you see that they're doing really well and not having strong reactions, then you have so much more peace of mind, and then you feel comfortable treating. This is a skill that we all need to have. We should be deworming ourselves at least once a year. And if you have no neurological symptoms, a person could start with just herbs. But when you have neurological symptoms, we know that the parasites have moved deeper into the body, and it's very difficult to treat only with herbs. I wish we could. Maybe we'll find a combination that can cross the blood-brain barrier and do well enough. I doubt it, but unfortunately, that's where we're at right now. But the exciting thing is there are options, but you need to work with someone. And the really frustrating thing right now is that we don't have practitioners that are skilled at treating parasites. There are just a handful that I'm aware of in North America, not in Canada. In Canada, it's almost like we're forbidden to treat parasites here because we don't have parasites. All our animals do, right? Our cattle do, our horses do, our dogs, the cats, but humans just don't get parasites, and nothing could be further from the truth. So the best treatment is really what kind of parasites you have, and because it's a lost skill. It's not really new, but it's a lost skill. So because it is a lost skill, the best way for you to recover is for you to learn this yourself, and then you work with your practitioner and you can guide and direct them, and I help with all of that. But it's very important that you play a very active role if you really want to recover. That's how people are recovering. It's not a passive role. It's not like, hey, I need a pill, fix me. That doesn't work, and it isn't going to work. Hi, Deborah. Where did you find that video of the worms? Where did you find the video of the worms? I'm not sure. Oh, you're probably talking about Dr. Alan McDonald. So go to livediseasefree.com, livediseasefree.com. Under research, the main menu, research, go down to parasites. You'll find the link. You'll just click on it and it'll take you right there. I also did a great video in the infection playlist in Live Disease Free YouTube. And I just really highlighted what he found. So in the different pictures, so you'll see pictures of those stupid worms mating, and you'll see little immature forms and clusters of them. And this was very abundant in the spinal fluid of MS patients, the filarial worms. And then also the tapeworm, that would be, just look at one of the quite recent, probably 3 or 4 weeks ago that I did, the tapeworm larva. You'll find it there. And I shared Dr. Alan McDonald's poster there. All found in MS, central nervous system. What parasite causes skin lesions? There are various ones, like some of the, I'm trying to think what they are. Some of the filarial worms can, fungus definitely can. So it would be, definitely there's different ones that can. And I would need more information for sure. So do those parasites cause the lesions in the brain? Yes, they do. Hi, Ramon, and hello. Hi, Mia. So this is a year 11 for me with MS, 11th year for me with MS. You're tired of not being able to move forward to support with support from your doctor. I know. I am so sorry. It's just brutal, but that's just the way that this world is right now. And we're going to work really hard this year to help, in every way that we can to bring this out. I would love to work myself out of a job. This is something that the doctors should all be doing and not me. And it's really frustrating that it's something that when people hear about it, it's like, oh my gosh, this makes so much sense. Like, I've had stomach issues for years. Some people said I've passed worms. I've seen the worms coming out. So it makes so much sense. It's so simple. And yet there's no money in treating parasites. And so that's really why it's been ignored. That's what I believe. You won't do another lumbar puncture, Joanne? Yeah, it probably was not very comfortable. And I'm just concerned about introducing infection. If you don't have to do one, I personally wouldn't. Mia, could MS patients should they get the, I can't talk about that, about the COVID vaccine. I can't talk about that I'll totally get censored. So if you want to know our opinion, you would just email info@livediseasefree.com, info@livediseasefree.com, and we'll send you out what we believe. I've done a ton of research on this, and this is just my opinion, but it's really important. I've just collected some really good resources of amazing different experts, researchers, immunologists, virologists, and it's very important that you make your decision based on being informed and not out of fear. Because you cannot, if you do it out of fear and you don't know what you're doing, and if there are long-term, a lot of us are dealing with MS already, and then if we have other more significant issues to deal with, that would just be brutal. So it's very important that you become informed, you really understand what it's all about, what it is, what it isn't, what the risks are. Then you can make an informed decision. And I trust that you can do that. You're smart. Do you approve of the Dr. Terry Walls protocol? Johnny, I think it's a really great start. She goes paleo, so she is lower carb, and that's definitely going to help people to feel a lot better. But unfortunately, at this time, she's not focused on treating the infections that are causing the MS, and that is the problem. So even with her, if she eats the wrong foods, she says that she can get some really strong nerve pain, which she has to use medication for. But when you treat the infections, you don't have that. You have to, and it's really important to treat these infections, to treat these parasites, because as they age, they keep mating in our central nervous system. They keep mating in our intestines. They become more populated and we become more weak. So we're carrying this burden of infection, parasites, and we need to treat them. We need to get them back down into balance. And then I believe that eating a little bit lower carb is really healthy for longevity. So then when people have recovered, we go a little bit more lower carb than she does, probably more like her Paleo Plus, where we wouldn't have smoothies, we wouldn't have chocolate or wine or caffeine. All those things will definitely make the infections happier, and we definitely don't want to do that. So we're a little bit more stricter because we want to make the treatments work as effectively as possible, which is the key. And trust me, if we could still have chocolate and coffee and alcohol and just treat the worms, I would tell you, but we're not at that place yet. So I think I love what she's doing. I think she's wonderful, but I'm really hoping that she catches on to the infection part, because that's really the missing piece that she doesn't have. And unfortunately, a little while ago, maybe a couple of years ago, there was this surge in the MS community about, oh, parasites, they will help you, not modify, but to help the immune system to not attack itself. Again, I don't believe that. I don't believe the immune system is attacking itself. I believe there's out of control inflammation. I believe there's immune dysfunction because of the infections. But giving people pig whipworms is not the answer. They have so much gut discomfort that they have to be removed after a while. It's not the answer. So it's not going to modulate the immune system. I definitely wouldn't want to go there. So So Facebook user, I don't know who you are. So I help students find practitioners. Otherwise, you got to try to figure it out yourself. It is a lot of work. It really is if you don't have a plan. And I didn't. It took me a long time to figure this out. Renee, you just got off steroids. You have ringing in your ear. That again is part of the infection. So when you're on the steroids, it's suppressing your immune system more. And those parasites, they will affect your hearing, your smell, your taste, your sensation, all of your senses. So that is what that inflammation, the tinnitus, the ringing in the ear, that is part of infection. You're very welcome, Joanne. What is the diet? It's called the Live Disease-Free Eating Plan. You can find general information about it on YouTube. Again, we have a playlist. You can watch a couple of videos. There is a cheat sheet that you can get, and that is in the Live Disease-Free community. If you join that, you can get the cheat sheet there. And on the videos, I talk in great detail about it. But it's basically going to real whole food in as close to its natural state as possible, getting the total grams of carbs down to 35 to 40. You will start to feel a lot better. So we still can eat a little bit of nuts and seeds, but if people eat too much, they'll feel horrible because it's too many grams of carbs. Hi, Anita. You're ready to treat. Yay, that's awesome. Hi, Daryl. Hi, Linda. I'm so glad you enjoy this information. See if there's any last quick questions. I'll just wrap it up here. Any discussion with Matt Embry? I haven't. I know he is also a film producer. I know he's quite busy, and his eating plan is great. Also, it is lower carb. It is more like whole food, etc. But he's not into the infection part. My life is so busy just supporting the students and working with M-City, and I just have to stay focused. And so, unfortunately, I haven't had a chance to reach out to him recently. Hi, Tanya. It is extremely exciting. It really is extremely exciting. Hi, Ryan. Awesome. Daryl. Pam, I have a dog. What kind of clean? I have a dog. What kind of clean? I'm not sure what you mean. Maybe what kind of parasites, like to treat your dog? I have dogs too. And we just got a dog, a rescue dog from the Animal Society, and went to the vet. She's perfect, beautiful, Great Pyrenees dog. But it's so interesting that with our vet, and it's a really good vet clinic, like they have great reviews and they're really good. With this whole COVID thing, they let us come in with the dog, etc. But the problem is that he's just like, okay, let's see, to deworm your dog, let's go on the internet. And he's like typing away, okay, what kind of parasites would be in this area? Okay, it looks like it's this and this type of parasite that's in this area. And it's like, no, like you need to see like what our parasites are infecting our dog. So you could do energy testing with your dog too. So if you, let's say, Daryl, if you're going to be energy tested yourself, a lot of times these people will energy test your dog, and you can do it like surrogate, where you put one hand on the dog and then you'll hold one arm out, and then they can test different treatments for the dog through you. They do that with children also, because children are not going to sit still or hold their arm up, etc. So this is like advanced muscle testing, and we would only do it with real practitioners like chiropractors, naturopaths, people that do this as a healthcare practice. They've got a lot of health background. And that's what I would do, and that's what I'm going to do. So I have a friend who's a retired naturopath, and he does energy testing for medications for our students in this area. And then I'm going to get him to energy test our dogs too, so that we have a better idea of which parasite drugs to use. Very often, though, with the dogs, deworming them, they'll use 3 drugs that will catch roundworms, tapeworms, and flukes kind of thing. So that's kind of helpful. Okay, last 2 questions here. So Joanne, you also have constipation. Yes, that is caused by the parasites. So Stephen, you've been on the diet for a month and you feel great. Your balance is okay. All just from a little bit better, still work to do, but it's a good start. I'm so happy. That is awesome. Thank you so much for giving me that feedback. So Stephen, I don't believe I'm working with you. don't think so. I'm sorry. I don't believe that I am. I think you're just following the eating plan and you're starting to notice those symptom improvements already. We've got a lot of students that just joined up in our program, which is so awesome. I am so happy for you. You have to treat the infections too. Awesome. Thanks for all the kind words. All right, I'm going to go. You guys, there's a lot more questions here. This was a really awesome time with you. And we're going to learn more and more about these infections and how to treat them. But again, you need support in the treatment part. There's lots of work you can do to start, like you can start changing your diet, following the videos I have on YouTube, on the Live Disease Free YouTube channel. Make sure to subscribe so that you know when I'm going live. Usually it's Wednesdays at 5 o'clock Pacific. And I'll be back next Wednesday at 5 o'clock Pacific on another amazing topic. But if you're at the place you're like, Pam, thanks for all the free stuff. Like Stephen, I've been changed my diet. I've been noticing improvements. I really believe that I have infections and I need help. I need support. Will you help me? Yes, I will. Make sure to watch my masterclass training. It'll be posted in the feed of this video. It'll be posted above the feed. Watch it. And then if you want to join the Academy, then you'll be able to book a time with me. You'll watch the Coachathon, which explains the Academy in great detail. So it'll answer all your questions and then you and I get to chat. And it's really fun because then you can ask very specific questions and I can get to know you a little bit before we start working together. So until next week, and we will announce on the Facebook, Live Disease Free, and probably Instagram, we will announce the winners of the Live Disease Free Eating Challenge in 2 days. So have a wonderful week. We'll see you next time, 5 o'clock Pacific, Wednesday, PST. See you then. Bye-bye.